Hi, I'm Lana Seiler, licensed clinical social worker, and this is Therapy Unboxed. I'm a clinician at All Points North, and I wanted to do this show as a learning opportunity for people in the behavioral health field, as well as anyone else interested in these topics. In each episode, I will focus on a behavioral health topic, which can include things like theories, modalities, diagnoses, concepts, even clinical terms, just to help us get a more thorough understanding. I'll usually start off with a general definition of the topic, maybe go over a brief history and some common misconceptions. I really love to learn, and I'm no expert in everything, so I'm really excited that we have expert guests to join me from time to time to help us dive deeper into these topics. I'll wrap up the show with some takeaways and key points. Join me and my expert guests as we unbox therapy from the inside out. So today we're going to talk about creating safe space for the LGBTQ plus community in therapy and treatment settings, which is a really incredibly important topic. It's something that's very near and dear to my heart as a member of the LGBTQ community myself. And I have with me today my friend and coworker, John Hardman. He also works for All Points North, doing mainly intake assessments at this point, but he's also a clinician and highly skilled and a very valuable member of the team, and I'm really happy to have him on. He's also doing an LGBTQ support group with our clients, which has been incredibly powerful and helpful for them navigating, getting help in this setting, dealing with some of the specific issues. Thanks for being here.
Yeah, thanks for having me.
So this topic has been in and out of our culture for many, many, many years, decades, generations. I think, we've gone through periods of time where things have been better for the LGBTQ plus community and also worse. And I think, we'd like to see it as a projection headed up in the right direction. And I think we are overall, but there's still stumbling blocks that we run across. And especially, I think, in healthcare settings and mental health and treatment settings, this conversation needs to happen, and it needs to happen more and more. I hear a ton about members of our community, particularly the trans community, where there's still a lot of roadblocks to get help. There's still a lot of roadblocks to feel comfortable with providers. And I can't think of anything more important in the journey toward health than feeling safe and comfortable with the people that are helping and treating us, because it's a risk to get help. It's a risk to reach out and kind of hand over some autonomy and some of our, freedoms, right? To a facility, to a person, to say, hey, I need help. I need guidance. And if there's any feeling of, I don't know if this person quite sees me, or I don't know if this person quite understands me, it can really present challenges. And so I'm super excited to be doing this today. There are some misconceptions, right? So we can talk a little bit about that, and then we'll get into kind of the meat of this. I think some of the misconceptions are that, and this kind of, I think, goes with the race issue too. We can be colorblind, or we can be gender blind, or we can be sexual orientation blind. Yeah. And I think that while most of the time that's in good spirit, I think it doesn't quite capture the real issue, which is that we don't want to be invisible.
Yeah, it misses the culture, right?
Yeah.
That we all live in. And I think that's one of the, most important topics here is to talk about. This is a culture, and it's cultures within cultures that as therapists we need to try and understand. When I first started working here at APN, we had a lot of patients that were from the Jewish Orthodox community. Do you remember?
Yeah, I do.
You worked with them before you even got here.
Yep.
And, I didn't have that much experience with that culture, with that group of people, but it was my job as a therapist to get to know them.
Yeah.
And get to know their culture and their family systems and their trauma, right? Very unique things about these folks that in order to help them to recover, I need to understand it, right?
Yeah.
And that's kind of the same thing with the LGBTQ community. You can't just put up some signs, right? We appreciate the signs.
Yeah.
And all of our patients that I talk to say, wow, that's really helpful. I walk in the door, I see a safe space sign. It's very positive. And also, I need to be understood, and I need to see that my therapists and the staff that are working with me understand that I come from a unique culture, family system, and so forth. So, yeah.
Yeah, sort of that this is a part of who I am. This isn't entirely who I am. And incorporating that part, right, is huge.
Recognition and validation.
Yeah.
I think. And that's, like you said, that's what gets missed when we kind of, I don't know if whitewash is the best term or make it just neutral, like, I don't see a difference between anyone. We're all part of the human race. There's some truth in that, but it also kind of takes out the value, the uniqueness of this group of people and what they both have to offer and their unique needs.
Absolutely. Yeah.
Yeah.
I think another common misconception that we run across is that, and you touched on this, that there's a lot of like homogeneousness, like that in the LGBTQ plus community, like it's kind of black or white, like we are or we aren't part of this community. And I think there's tons of gray area. We know sexual preference and orientation is a spectrum. And I think more and more, I mean, one of the things that warms my heart is how many young people are just embracing this beautifully. Like I talk to young people who are in grade school, middle school and high school, and and even being involved in like pride parades and things. There's tons of young people who are not afraid to come out because I think their peers are starting to be more accepting, even more so maybe than teachers and adults, but just kind of like that it doesn't have to be you are or you aren't. There's a lot of gray, there's a lot of fluidity, and it's just not as much of a big deal to them, which I love, but that misconception of this like black or white thinking around it too.
Yeah, this is the young queer community, right, and trans community that, really represents both a unique culture and a sense of like, it's okay to be me in this world, right? And it's exciting to see that a lot of their peers are really supportive of them in this. I look at the difference between us at our age I'm older than you,
just a tiny bit.
When we were coming out and so forth, and one of the biggest concerns is, will my friends accept me?
Yep.
I think that is less of a concern today, although I would say there's a lot of communities still that we struggle with this.
Absolutely.
It does make a difference if you live in a big city probably versus a small town, right?
Yeah, yep.
So, but this, I went to the we met at the second only Pride that Avon here, right next to Edwards, a little town called Avon, where we met there at their second only Pride.
Yes.
And we were just both looked at each other and we said, look at all these younger queer folks who are out here, and they're just happy and support, and they've got their signs and their flags and their faces painted.
Yeah.
And they were just and very family friendly.
Yeah, it was so heartwarming.
Yeah.
They're just flourishing.
And I saw a lot of families out there supporting them.
Yeah. It's great to see, and I'm glad you brought up that point though, that we're not in a place where that's everywhere.
And that's a big point here. And even within treatment, we have people, obviously who are either uneducated or just they haven't embraced the culture to a degree that they're really ready to talk about it.
Yeah.
Our folks here, they appreciate everything we've done. They're very positive about APN, and they say still they find it hard that many staff members don't introduce themselves with their pronouns.
Yeah, right.
Which I think it's hard to understand what validation that really is. if you're not used to it. But these are, people who are often completely rejected in their communities. Trans people who their families won't even recognize their transgender, their sexual identity, and as much less call them by their pronouns. So it's this really strong show of respect when a therapist in their process group says, I'm so-and-so, I identify, and these are my pronouns, right?
Yeah.
What an example that sets. And these are the kind of cultural things that I'm hearing from our LGBTQ community in treatment that they want, and they feel like they need to sit in a group like that and talk about their trauma, right? Which involves stories about things that some people really don't want to hear, right? Because it's not mainstream. It's not, kind of the classical idea of family or so forth. And it's a powerful thing to feel supported in that way.
Yeah, this is a good segue into sort of the topic of today, which is how do we as clinicians, as treatment centers, as providers, and friends and family create safe space for this community? What are some of the things that are helpful? And you mentioned one already.
Yeah, I think that particularly is one. Last week, I'm lucky I get to do an LGBTQ support group here, facilitate the group here at All Points North, and I asked them, what are we doing well and what aren't we doing well? What can we change? And they did bring a lot of positive things. They appreciate the signage, the bathrooms. They appreciate most of their therapists and the counselors and milieu counselors and all the different folks. Having said that,
yes.
they have a few.
Yeah.
They have a few things, and one of those is that they feel at times they can't talk about themselves in a mostly heterosexual group. Right? If there's two or three, or maybe just one, let's say gay person in that group, it can be very difficult for them to talk about their alternative family, for instance, their family of choice, and what they really see is a lot of microaggressions. So that's the snickers, the body language, the discomfort. We're experts at reading our room, right? Because it means we have to be safe. And in order to be safe, we need to know what the attitudes are of the people around us, And so, a lot of the folks that come to my group talk about things in the LGBTQ group that they can't in their normal process group, right? Or they feel like they can't.
Yes.
Or they just haven't quite felt supported enough to bring out, right?
Yes.
So this is we've made a lot of progress in treatment. At this point, we've recognized the problems, we recognize the culture, we recognize the need to create comfortable, safe, supportive spaces. And the next step is, rather than just worrying about so much the signage, which is great, it's also what's the attitude the staff takes, what's the how do they validate the culture, the uniqueness of folks in their groups and in their therapy.
So what I'm hearing is it's great to have, and the stickers we're talking about are those rainbow stickers that say this is a safe space.
Yeah.
It's great to have those, and it's great to, for example, we have our pronouns in our email, right?
Yeah.
So those are steps in the right direction, but it's not quite enough. We need to be more active, is what I'm hearing, in the support. So identifying ourselves, sharing our preferred pronouns, and then being, as the facilitator, the provider, being very aware of what's happening in the room and supporting the safety so that these members of the community have
yes. One of my
freedom to share.
One of my patients who comes to that group a while back. They've moved, on to IOP since, but said, I'd rather than a safe place, I'd rather it be a brave space.
I love that.
Yeah, where we can talk about, even when this stuff comes up, we can talk about it in group.
Yeah.
And we can have the courage and be supported and having courage to, be brave and talk about, what are the problems, what are the concerns here and the issues. It's kind of the evolution of this process into a more friendly, invested state of mind with our professionals.
Yeah. Thank you. So let's talk a little bit about those microaggressions. The first thing I wanted to talk about is we mentioned group and the fact that sometimes, as much as we try or want it to be safe and brave, there are members that may have feelings or attitudes or judgments. How do we best handle that? What do we do? It's hard as a clinician.
Well, I think, for one thing, recognizing that there is a parallel process with staff and patients.
Right.
And in a treatment center, whatever's going on with the staff will be reflected in the patients, and often what's going on with the patients gets reflected in the staff, right? So, so I think we need to be kind of the leaders in these groups as far as looking at ourselves, right? So we all have some of this. Even people in the community, we have our own internalized homophobia, they call it. There's internalized all kinds of phobia, right? About ourselves. And so we even have our own microaggressions we don't always recognize.
Of course.
And so I think one of the big things I see with therapists is wanting to, believe it or not, folks, all of us therapists, we want to be liked too. And, often our job is not to be liked, but we want to be liked. And, so often placating the majority of the group, can be a microaggression, like, let's not talk too much about that. Maybe we don't want to go into, minimizing the person's problem, like, say, well, everybody goes through those kinds of things. These kinds of things could be ways that we stumble. And I think being aware of the other patient's microaggressions. Now, this is a hard thing as a therapist to know how do you address this in the community, because it's, this isn't school. We're not teachers. We can't put somebody in the corner and say, right?
And we also don't want to minimize the other participants' experience either.
That's right.
So it's a balance.
It's a balance, right? And so I think it's maybe we just need to talk about what microaggressions look like in a group, when we see them coming up. Like, what are you uncomfortable with? I mean, because some of us probably are uncomfortable with this topic, right?
Yeah.
This is what we're taught to do in school and therapy is, like, we can talk about everything in group, right? We bring it up in group, right, is what they say. And so I think we have to work on ourselves and our comfort level with letting uncomfortable topics, not just uncomfortable topics around, trauma and so forth. It is trauma. It's all trauma. But letting ourselves sit there sometimes with the discomfort and not placating, to the majority at times. I think that is one thing we can do.
Yeah. There's so much on this that we could get into.
I know.
I'm thinking to myself, like, some of the times that I've had moments in group where it's been uncomfortable around LGBTQ plus issues and other issues too, but we're going to focus on that today. And I agree. Like, I've even, one of the things I try to do as a clinician is always be as aware as I can of what's going on internally. And I've remember at times feeling that, like, tiny little sort of like, oh no, this is going to come up feeling, right? Yeah. And then my own sort of position, right, of this issue is very much also an issue that I personally have to deal with in my life,
Yeah.
right? Us as
like,
members of the community.
I don't want them to think because I'm gay
Yeah.
that I'm giving more, attention to the gay members of the group,
Yeah.
right? So, right?
Right, right. And even our own, and I'm sure I'm not alone in this, our own, like, if there is that judgment in the room, like feeling a little judged too.
Yeah.
Right. At times it's in there, right? Consciously we know to like work on it and put it in the place that it's supposed to be in, but it's still, we have to acknowledge that stuff comes up sometimes. And there's a lot of dynamics at work here, which make it tough for clinicians to sort of make everybody in the room safe enough to have the discomfort.
Yeah. And, we're all therapists for the heterosexual patients, for the queer community in the room as well. And
Yes.
so we don't want to damage or in some way prejudice our relationship with them either, right?
Yeah.
It's a hard balance at times.
It is.
But it also, I think, the spirit of this, really we're talking about a spirit of kind of compassion, right, at this point. Yeah, I don't really believe, I don't think we put ourselves in that position when we're coming from empathy and we're coming from compassion, right?
Right.
In fact, it's usually just a more valuable experience.
Right.
In regarding the relationship, right? Where the relationship between myself and the patient.
And I think a lot of work gets done too in practicing being uncomfortable and practicing having difficult conversations, the patients practicing doing that. I think there's a lot of really good clinical work that gets done there because this, what happens in treatment happens outside of treatment.
Yeah.
So this is a place where people get to experience their own discomfort, experience the discomfort of others, and have these hard conversations.
Yeah, I'm so impressed with our family program and family therapists who help a lot of times have these real difficult conversations with their family, right? And then we're supporting them in that. We need to be able to have the hard conversations ourselves.
Yeah.
Yeah.
Are there any other sort of like missteps that treatment centers or therapists or other providers, even medical providers, can take that we want to be aware of?
There's probably a number of things that we've been through over time. I think there's a lot of questions right now about should there be, specific treatment for just the LGBTQ community. Like, should there be treatment centers just for that? And there are, there's programs and so forth. Is that a positive or not? I think for some people, maybe they need that. For a lot of people, I think they want to be, like, I think especially the younger queer community, they don't want to be separated necessarily. They may want some periods, some spaces where they are separate. But I don't think they really want to be, in a group without their heterosexual friends and supporters and so forth, peers, right?
Yeah.
So I think that, can be a misstep to think, we're just going to go with a full-on, and I don't know. There's no perfect formula. I think there's value to some of those programs as well. I don't think it's what the up-and-coming kind of queer community wants. But I do see the value in having like an LGBTQ support group or groups, spaces and so forth.
I know there's been some challenging questions about the trans community in particular and housing.
Yeah.
I've run into that in a couple different treatment centers where, the conversations are being had as what's the best thing for this person and what do they want. And do you have any thoughts on
and
how
there's
we
some
can...
states that maybe there's even laws and things that would restrict, it's tough right now. I have to just express my own opinion on this. I can't say there's a research or something to go by that with transgender people, we should be in support of the gender they they see and they're recognizing themselves, their gender identity.
Yeah.
If they identify male, then they should be supported in being in all the same spaces as the male patients,
Yes.
and female. And then you might ask about fluidity. Fluidity. We have to ask that patient, I think. And I know this affects the other patients in the program. Some other patients in the program aren't comfortable. And maybe we can, have conversations with them and respect their needs for safety too. But there's plenty of people that are.
Yeah.
And plenty of people that are actually very open and want to be supportive.
Yeah. Yeah, I'm finding that too. It's encouraging.
Yeah, so that's I think we're yet to be really good at working with transgender folks.
Yeah.
We're in a stage of I think good recognition and so forth, and I think our medical folks have really come to the plate as far as educating themselves and being up to date on hormones and specific pharmacology associated with the transgender community. And I think, let me put it this way. I work with the best people in the world. Therapists and people who want to work at rehabs don't work here because it's just a lovely, pleasant, non-triggering environment.
Right.
These are people who really want to be helpful and really have a heart for the work in general that we do. So I think we just need to kind of recognize that and help each other along. But as a community, I think we're probably a safer community than you would come across in the outside world.
Yeah.
How do we continue to forward our work with transgender people? I think we're all asking that question. How do we make safer spaces for them? We have to send transgender people back out into a world that's very threatening.
Yes.
To them.
Yeah.
How do we prepare them, give them support and coping skills, and most of all, help them to learn how to keep themselves safe.
Yeah, I think one of the really important things too about the conversation is to continue to have it.
Yeah.
And, Dr. Daly, who's going to be on another episode, she is a psychiatrist who works with us and she's a good example, right? She's done additional medical training on the transgender community and how to be helpful and supportive to them. And so, getting additional training, whether it's in the medical field, getting additional support clinically from our peers, having the conversations in our clinical consultation groups, I think my opinion is that this is the way that we're going to get better, by continuing to talk about it more, not being afraid to bring it up with our supervisors and our peers and ask questions about how to handle this. And like you said in the beginning, John, really eloquently, it's our job, frankly, to be culturally competent. It's our job to learn about how to deal with these issues in the most supportive way. John, thank you so much for being on the show. It's such a rich and wonderful conversation, and hopefully we'll have you back on again to talk more about this going forward.
Thank you. Yes.
Thanks for listening to Therapy Unboxed with me, Lana Seiler. Subscribe and tune in each week for new episodes. For more information and resources, check out apn.com/podcasts. For questions about the show or for resources on this topic of safety and bravery in the LGBTQ+ community, please email us at pod@apnlodge.com. pod@apnlodge.com.